Sure. What I was going to do is give you a couple general updates as an introduction, and then I'm going to ask Vivian to pull up a couple different websites. First, I'm going to, after I give you some general things, ask her to pull up the website that shows us kind of it's a different version of the Sonoma County dashboard. And I think it's helpful to just go through some highlights in that of those numbers to give us some context. And then I'll pull up the one that you referenced, which is being used to help us monitor our gradual reopening and kind of the ongoing measures that are happening. So this first, just a few kind of words while Vivian, if you want to start pulling up that first website, I can speak to it. But I think overall, the message that I would say is that we're stabilizing in our area, especially the Bay Area, and we're learning how to coexist with COVID-19. The curve was definitely flattened. We've nowhere gotten rid of COVID-19, and I think we're realizing that that's not likely to happen until we have a vaccine or other therapeutics. But we are very much being successful in our mitigation factors, and the numbers are very confusing. So that's kind of what I hope to address to best of my ability. I'm not sure anybody has 100% conclusive answers, but I can try to interpret them. The other thing that I think we've made a lot of progress on is testing, and that's what makes the numbers a little bit confusing. As you probably have seen over the last week, the statewide has hit their goal of over 60,000 numerous times in the last actually 2 weeks. And so with that, obviously, good and bad news is we're seeing a lot more cases, but some of that is finally getting us to the point of actually having a real number of what has been out there. And it was probably a lot worse than we knew, probably in late March, early April is really one of the big messages. And antibody testing is still a work in progress. I can discuss that separately as you'd like, but the good news is PCR testing is now widely available. The shortages with regards to swabs, transport mediums, those type of things are really not an issue. We personally now have great turnaround time with UCSF, and that has really allowed us to open up the hospital further with a lot more security. Further then, I kind of want to go through a little bit of the data with you. So this is one of the Sonoma County coronavirus dashboard. They have a more glossy graphics, but I find this easier to look at. So a couple of things just to point here is the numbers, yes, they're rising. That's 593 total. So compared to most areas in the country or even in the Bay Area, we're very low. And the good news here is you'll see they're also tracking the number of tests performed to date. We've performed over 28,000 tests in Sonoma County, which is for our population quite a lot. And the big news is here, we're up to 916 for their last reporting. These are about 24 hours ahead, behind time. And we've been in that range of between 600 and 1,000 for the last couple of weeks. And with that is where we've seen our increase in numbers. And so actually I look at this as really good news, and I'll show you why as we progress down. The other thing to note here is that how we define recovered is very loose for everyone. And different agencies have different ways of doing it. Very few are actually doing it very formally, where you would have 2 negative tests and follow up. Many are just doing it based on an amount of time passing and knowing that those patients aren't hospitalized. So I don't put as much weight definitely on the actual recovered numbers, just to know, because the science behind them varies a lot. But it is important to know that, yes, 593 cases are not active by any means in our community. That's what, since we began tallying this sometime in March. Can you scroll on down, please? And just as you go through some of this, you'll see how we compare to California. And if you'll scroll on down to the counties in the Bay Area. And as you can see on this, we are definitely, there's kind of half that are above the 1,000 mark and the other half that are below. And we've definitely been in that lower mark, and we've been kind of slow and steady. And we continue that way. The other thing that I think is becoming more and more of a sign of what your true impact or numbers are the deaths. Because we know that the case counts have always been and continue to be less than accurate because of the testing inaccuracies, availability of testing, and many factors. So the fact that we've only had 4 deaths in Sonoma County is quite remarkable. I will also point out, though, that as you've probably seen in the news, some people are not sure that we've captured all of the deaths and attributed them appropriately to COVID-19. But as time goes on, I think we're getting better at that. And so I do feel that the death rate and hospitalizations are maybe 2 of the more important numbers to look at going forward than the absolute case count for many reasons. Can you go ahead and scroll on down? This is another just interesting one I like to keep an eye on. Again, you can also see that in the recovered numbers, they don't change them every day. So again, that indicates that this is more done after a time lapse than on a daily inquiry, because we do see testing repeated and some being positives and negatives. But what here, let's just give you a little idea of the last snapshot in the last 5 days, and up and down, but we've been averaging anywhere from 5 to 15 cases, which is really kind of a steady trickle. And this is really an important number here. If you notice our positive percent, so this is of all the tests we've run, 2% have been positive. When we started this, we were celebrating that we had about a 4 to 6% positive rate. As we got more and more testing, it's been lower and lower. So this is what we're finding, is that in a lot of places, want to keep it below 8%, and they're much worse off. So below 2% shows that we are doing very, very well. And the more we test, that number actually continues to drop. And that's important because then that absolute number of positive cases is a lot less scary. When you look at the total percentage, it shows you it's more that we're actually capturing what's out there much more effectively than we were in the beginning. And then the cases by region, again, this at first I was really hesitant to put much weight in this because, and I still am for many reasons. Yes, how people are assigned to this area does not necessarily mirror where they go on a daily basis or where they work. It just might be the address they list as living. So that doesn't necessarily show our risk factors for our community, knowing that many people come and work in our community that don't necessarily live there. But it is interesting, and it does show us that population density is where your cases are. And I think we've seen that time and time again. You want to scroll on down, there's one more thing that I want to mention. The ages and cases and sexes and things are quite equal, but if you can stop there, the race and ethnicity one, if you'll notice, this is something we're seeing throughout California. It's been, of course, a lot in the news that many races are disproportionately affected by this disease, and African Americans have definitely been called out recently. But in our communities, what we're seeing is the Latinx population, and that's throughout California. There was a study done in a mission that mirrored this as well, and Sonoma County is virtually the same. 70 to 75% of our cases are in the Latinx population. There's a lot of reasons postulated for that, but I think also importantly, this is being recognized, and I do feel it's being addressed as best as we can at this time. And that's through some contact tracing, and also through opening up testing to be without needing an appointment, to be without needing an address. Some important factors in our community to make sure that all feel safe getting tested and that they won't be tracked and traced based on those results. So some important work is being done on that, but it's far from over because we obviously see that this is unfortunately extremely disproportionate and not at all representative of our population. If you want to scroll down, I think there was one more spot. You can keep going. And okay, that's it on this one. And then if you want to pull up the other one, it's the one that Kelly sent to you. But I thought that this is a good background to have because this kind of gives you an idea of what the prevalence is in our community. And you need that context to look at the next one. The next one, you also need to know where it came from. The background behind this is that our health officer, Dr. Mays, has been obviously monitoring the criteria that the state has put forth in order to open up in all the different phases and requirements that those may be. And that comes from a lot of different public health officials putting their heads together and looking at what could we possibly track as far as data and indicators that we are doing well, or that we need to change things in order to address an outbreak or a shortage or many different things that could be impacted here. So they put together a list that they thought was comprehensive of things that we could possibly use as indicators to tell us, yes, we think it's fairly safe to move forward, or wait, we need to pause, we've got a problem and we need to address that before we can move forward again. At this point, everybody is doing their absolute best to avoid another, harsh shelter in place, and continue with the mitigation factors for as long as this takes. This specific set actually came out of the attestation to the state to move forward with a variance, meaning that Sonoma County initially chose to go a little faster than the state because they felt they met the requirement faster than the state was. So this was to address that, and that's where these numbers initially came from. Now it's, as I said, it's being used as an ongoing monitoring tool to see how we are doing and to determine when we can possibly move forward further. The other thing I want you to take a look at before you get too into the numbers on the current state is look at the last column, less updated. Unfortunately, some of this is only updated on perhaps a weekly scale or less, and things are changing pretty rapidly. And so some of it, the context is difficult to interpret because they really are rolling numbers, and a 1 week compared to next can be quite different. So for instance, we're doing very well, as I said, in the case transmission. We're down at the testing positivity rate is only 2%, and they want to be less than 8. One thing that is here and not quite accurate is I've been tracking it on other websites is this case rate per 100,000 residents for the past 14 days. About 14 days ago was the first time for that week that we really had the adequate number of testing met. And with that, we definitely saw a spike in cases reported. And that is when this number significantly rose. Since that time, we've seen it steadily decline. And then you'll look down to some of the other things that they're looking at is the percent of hospitalizations. So I always look at these ones in context, because how do we know if the number of raw cases going up, is that significant? Is that testing artifact, or do we have an outbreak? So that's why these have to be used together, and not any one indicator is a red flag. So the other is the hospitalizations. Earlier, about a week ago, if you had looked at this, the number of hospitalizations was reportedly up. I have some questions about this indicator as well. These are self-reporting from many different sources that the hospitals do daily. It's a little unclear if rule-outs are included in this number, and there were some changes, and I know Sonoma was doing it as well as other hospitals. The more and more we move to universal testing, more people are sometimes considered rule-outs, and so it may not actually affect the positive patients who are hospitalized. So some of this is data artifact too. But the message is overall the hospitalizations are very stable, and actually statewide and baywide are the lowest they've been as of my last check today. So we are not seeing an uptick in the hospitalizations. However, that could be delayed response because people get sick before they get hospitalized on average a week before. But so far that's very stable. Other things are again related to increased rate in hospitalizations, absolute number, the fatality rate, as I spoke to, ours remains incredibly low at this point from the knowledge we have. And then one thing I did want to point out, this was the side, is the proportion of cases to community exposure. I think that's an important number that we've gotten with the contact tracing. We haven't quite met our goal of having more than 75 staff, but they've got 70-ish. And with that is really what we're finding is that the transmission is amongst close contact. It's not when you go to the grocery store. It's not when you touch something in a public bathroom. What we're seeing is that it's when you're in a closed space with another individual, and of course without a mask is much riskier than with a mask. And this is what this number continues to reflect, is that over time you'll see they were initially tracking travel. That number continues to drop because that hasn't been a recurrent issue. They were initially suspecting some community, and now pretty much the only number that we're seeing is close contact. They do the actual tracing. So, and a lot of that is one family member gets infected, and unfortunately, usually most of the rest of the inhabitants in the house are also affected. And for those reasons, they're set up the alternative care site at Sonoma State University to help deal with that, so that everyone has a safe place to go if they were to have symptoms and their test is pending or they are positive. So that's been a big initiative to combat that issue. And then the other thing is you're seeing is the number of tests. Their goal is 750. And again, I've seen this number continue to rise, and this was last updated May 26th. So I think we are starting to meet that goal. The governor's goal was to have this by June 1st. And I would say it's not 100% done, but we're very close to being at that level as well. And then, of course, they're monitoring some other indicators for vulnerable populations. They're looking at nursing homes. They're looking at people over age 65. As I mentioned, they're tracking demographics as far as race and things to look at inequalities in the system and obvious other reasons that we are not reaching certain populations. And finally, we all know PPE is, now a term that the entire world knows, and before probably had no clue, but that is fortunately really stabilized, at least in our area. We're all feeling that we've got protocols in place, that with smart use, with safe reuse, we have a sufficient supply to protect our staff and each other. And we're seeing that the universal masking policies that we've all adopted are working. And there's more and more studies coming out saying that those are extremely effective. So if the one thing we can do, it's probably mask and enclosed spaces. So that's all really good news. So that's kind of an overview of all of that. And I will go into more after this about specific stuff for Sonoma, but do you have any more questions about this data or in general or things you've heard? Happy to answer.
Do you know if somebody tests positive, but they're completely asymptomatic, are they considered recovered?
No, well, say if you test positive on a PCR, but they're asymptomatic, they are not considered recovered. They are considered an asymptomatic positive or a pre-symptomatic, depending on whether or not they eventually develop symptoms. That's an area that's still unclear. There's some data suggesting that we've had a few people that have recurrent positives for a long period of time, but have no symptoms. And they believe that that may be representing dead viral load, and that better testing or some additional testing down the line may help distinguish that. And there may also be a role for antibody testing in those individuals if they've developed a strong IgG immune response. Right now, most of our tests are qualitative, but if we eventually are able to look at a quantitative and it's above a certain threshold, we might be able to say that they actually have immunity and then definitively say that the PCR test is actually representing dead virus. So there's a lot of theories out there, but we can't yet prove them.
Got it. Okay, thanks.
Sabrina, do we have access to remdesivir and convalescent plasma for our COVID-19 patients?
Convalescent plasma is only on a study protocol, and we're not involved in anything at institutions such as our size. So not with that. Remdesivir is being distributed on a federal level in allocations. There is a county-wide distribution. We don't have any specifically allocated to us since we've only had very few patients at our facility. However, we have been told by our county that should we have a patient that's in need of it, we definitely need to speak up, and there's a probable chance that if one of our doses is available, they obviously would consider giving it to us. They did. There was a perfect patient, I believe, early on. I don't remember. I think it was in Mendocino County, and they had 0 allocated to them, and they quickly gave it to them. So people are working well together to get the allocated doses to the patients who could benefit from them.